Medical treatment of dumping syndrome. First, there are some diagnostic tests that can help with the diagnosis of dumping syndrome. Some or all of the following tests may be performed to diagnose. A modified oral glucose tolerance test is used to help determine if a patient has dumping syndrome. This test requires fasting for a minimum of 8 hours beforehand to test a true fasting glucose response. Baseline measurements of blood glucose and hematocrit and heart rate are taken, and the patient drinks a glucose solution and has blood glucose tested again right away. Blood glucose, hematocrit, and heart rate are tested every 30 minutes for 3 hours. Dumping syndrome is confirmed if blood glucose is low in the last hour of testing, hematocrit rises more than 3% within the first 30 minutes, and heart rate increases 10 beats per minute after 30 minutes. Another test that may be used to diagnose dumping syndrome is gastric emptying scintigraphy. In this procedure, the patient eats a simple meal that has a tiny amount of radioactive material in it. They are then monitored by a radiology technician who scans the stomach over the course of 4 hours to see how quickly the meal empties out of the stomach. An upper GI endoscopy may be used to check for ulcers or other physical issues in the gastrointestinal tract. In this procedure, a tiny camera is fixed on a thin tube that is fed down the esophagus into the stomach to show images of the inside of the intestines. General anesthesia is often used, or a liquid anesthetic may be sprayed into the throat to make the tube less uncomfortable. This test is used for many GI issues such as detecting cancer, ulcers, looking for scar tissue, and more. An upper GI series is another way to look at transit time in the GI tract. This procedure involves a patient fasting, drinking a barium solution which really coats the intestines. The patient is monitored by an X-ray machine to see how quickly the barium moves through the GI tract and if there are any blockages. Some common medications are octreotide acetate, which is an injectable medication to delay gastric emptying and the secretion of GI hormones like insulin. It comes in short-acting and long-acting formulas. Acarbose slows the absorption of carbohydrate in the small intestine, preventing the swing of hyper to hypoglycemia. This medication is only effective for late dumping syndrome. As with any medication, there may be undesirable side effects, and medications should be administered as prescribed by your physician. Surgical management of dumping syndrome. Since dumping syndrome is often caused by gastric surgery, surgical intervention should only be used if other treatments do not work. Surgery may be necessary to correct previous gastric surgery, but results are usually unsuccessful. Continuous enteral feedings, which is tube feedings into the intestines, may be necessary as a last resort, but findings are inconsistent and limited in research.